Hello, everyone, and welcome to today's Adult AML Chapter event brought to you by the HealthTree Community for AML program. My name is Katie Braswell, and I'm the HealthTree for AML Community Director. I'm so grateful to have each of you here for our meeting today and for your support in building this Adult AML community. I'd like to let you know that today's session will be recorded, and the recording, along with the slides and any resources we discussed today, will be sent via email to all registrants within 48 hours after the event has concluded. I know you are all probably pros at Zoom by now. This is our last event of the year, but I'll briefly walk you through a few features just in case you're new. We'd love for you all to turn on and keep your cameras on if you feel comfortable. Doing so helps us to create a stronger sense of community. You can see on the slide how to turn on your camera. At the bottom of your screen, you should see the microphone and camera buttons. You can click the video icon that says Start Video in order to turn your camera on. With that being said, if you're not comfortable being recorded, you're not required to keep your camera on. Your microphone should currently be off and will be kept off by our team throughout the presentation. During the group discussion, you're welcome to unmute yourself once you're called upon. If you have any questions or comments for us or for our speaker throughout the presentation, please click the chat icon and type them in the chat box. If you're using a mobile device or tablet, click the three-dot icon that says More and then Chat in order to access the chat. And lastly, if you would prefer to verbally ask a question or make a comment directly to our speaker during the discussion time at the end, we encourage you to do so. If you're using a laptop or desktop, click Reactions near the bottom of your screen and then click Raise Hand. If you're using a mobile device or tablet, you can click the three horizontal dots that say More and then click the Raise Hand button. And now let's get started with today's event. First, I'd like to thank our sponsors, without whom this event would not be possible: Bristol Myers Squibb, Amgen, Genentech, AbbVie, and Jazz Pharmaceuticals. The topic of our event today is titled Expanding the Stress Management Toolbox. Here's the agenda for today. I will introduce our speaker, Dr. Derry-Vick, and she will spend the next 40 minutes or so giving us her presentation. After the presentation, we will open it up for your questions and comments and end the event with a few announcements. So let me take a second to introduce our speaker, Dr. Heather Derry-Vick. Dr. Derry-Vick is Assistant Faculty Member for Discovery and Innovation and Assistant Professor in the Department of Psychiatry and Behavioral Health at Hackensack Meridian in New Jersey. As a clinical psychologist, she investigates how stress impacts health and healthcare experiences, as well as physiological mechanisms that raise risk for cancer and co-occurring problems. The Derry-Vick Lab's long-term goals are to lessen the impact of stress in the context of medical care and to maximize quality of life among people with cancer and chronic conditions. This is a topic that's come up so many times throughout the year, and a really important one to discuss in the context of AML. So we're so honored to have you here with us, Dr. Derry-Vick, and for you to share your knowledge with us today about stress management. And so with that, I'll let you go ahead and get started.
Thank you so much, Katie. And hello, everyone. I am just thrilled to be here with you today and appreciate HealthTree and Katie inviting me to speak with you. I'm going to go ahead and take a moment to try to pull my slides up. Let's see how that works. All right. I am hoping that you can see my slides at this point. Is that right?
Yes, looks good.
Okay, perfect. Thank you so much, Katie. So like I said, I am just thrilled that you've taken the time to tune in today for our discussion about a topic that is certainly very near and dear to my heart, which is stress and cancer and stress management. I'll go ahead and give a sort of overview for what I'm hoping to talk with you all about today. During my presentation, I'm going to start by describing a bit about stress, patterns that we know that arise during cancer, as well as the effects of stress. I'll also be focusing on a couple of recent research findings, specifically in regards to what AML patients have told us through research. After that, then I will introduce and hoping that we have some time to practice or make some plans around a few stress management tools that I hope will either be a good refresher for you on things that you may have heard about before, or might be new and a chance to try out something new in your day-to-day life. And then finally, towards the end, I'll talk a bit about when it might be a good idea to connect with a healthcare professional to help support your coping, as well as members of your healthcare team that are specialized in that area that can often help. So before we get started, what are we really speaking about when we're talking about stress? First, it's often important for us to recognize the signs of stress in ourselves. And this can be an indicator that really a situation has presented itself to us that has sort of pushed our boundaries a bit, pushed the demands a bit, almost like a rubber band sort of stretching to meet the demands of a situation. When we experience something like that, we can have changes in our emotions. So for example, feeling more nervous, more frustrated, more sad than usual. We also might have changes in the way that we're thinking. So for example, we tend to have thoughts that are a bit more worried or negative, or might sort of get away from us at times. And finally, we also often experience changes in our body or physical symptoms of stress, like difficulty sleeping, feeling more tense. Some people get headaches, trouble concentrating. These are just a few examples of signs that might signal to you that you are feeling more stressed. And certainly there might be things on this list that you don't experience, or others that are a bit more specific or unique to you. And so as we're talking about stress in the context of AML, as Katie has mentioned, it's not a surprise that this topic has come up frequently because there are many sources of stress for people dealing with AML. You see here just some examples of time periods that people have indicated can be particularly stressful for them, and that oftentimes we think, for example, of initial diagnosis and treatment as being particularly stressful, although what we know is that the stress of cancer doesn't stop after that initial period of time. And so you can see some examples here, and I encourage you to kind of think about, for you, what might have been some times that you notice your stress level fluctuating, and what might be some times that you notice that maybe you're feeling a little less stressed, because it's important to sort of understand how these patterns might change over time. And before we get too far in the talk, I do want to take some time out to say that, each of these things on the list that I presented here can really be very serious and can be life-changing at times. And so when we are talking about stress, feeling stressed or anxious or down in the context of these experiences is very natural, it's very common, and it's very valid. And so what I'm hoping to present to you today are some background information and skills that we can use to help deal with these times, but not to suggest that it's abnormal to feel stressed or that we can get through these experiences without feeling this way. Typically that would be concerning and uncommon to not have these feelings at times. But are there ways that we can sort of mitigate the impact on other aspects of our life? So if cancer-related stress is, pretty normal, pretty common, pretty unavoidable, then why might we, want to spend some time addressing it? We do know that there are potential negative effects of stress, and that the more that we can buffer against these impacts, the more that our quality of life can improve. So for example, really well-documented effects of stress on daily activities include lower ability to meet sort of other obligations or responsibilities, might be harder to do day-to-day activities. For example, even day-to-day being able to engage with family or work around the house or other things can be more difficult when we're experiencing stress. In addition to that, in the second bullet point here, we also know that we're not typically sort of our best social selves when we're feeling stressed or anxious. We can feel more irritable or tired, and it can be hard to engage with people who are important to us. It can also be harder to sort of establish our well-being overall and emotionally. In addition to that, stress can make our physical symptoms worse. So, for example, if you have been experiencing fatigue or pain or tension, and then you're adding stress on top of those symptoms, typically stress does not help, and typically stress might make those symptoms even worse. And so if we're able to sort of manage the component of that is due to stress, then that can make a positive impact. And finally, a topic of interest that has been of recent interest to me and our lab's research is how stress and anxiety might impact our appointments in healthcare. We know that we are often not thinking as clearly or have a difficult time sort of processing as information in the same way when we're stressed compared to when we're less stressed, and that it might also affect the way that we interact. And so what we've been looking at a bit more recently is how stress and anxiety can make it a little harder to engage in appointments as you normally would. And we're hoping to develop some tools that can be helpful for patients around these times. So next, I'd like to talk a bit about how we as researchers study stress, anxiety, and depression, and sort of how we know some of the things that I've been sharing with you. There are a few different ways, and these might be familiar to you. One of those is by asking people how they feel in survey format that you would fill out yourself. Others are through interviews or bringing individuals into the research setting to observe the way that their body or their emotions respond to minor stressors. And lastly, of course, we also conduct research to test whether different ways of helping people manage stress and anxiety are doable, whether patients find them acceptable, and also whether they're helpful. And so I'd like to share with you a bit of recent research about what folks have learned from people with AML in recent research studies. And I should mention, these are research studies that were conducted by some fantastic groups outside of my own work, but that I certainly think are very important. So for the first study I'd like to share with you, there have been a group that was doing interviews with AML patients who were in their first year after stem cell transplant. And what they found in the study was that patients mentioned that physical symptoms like fatigue and weakness and nausea were important to them, of course, but that they bothered patients less over time throughout that period. But on the other hand, what they also reported was that other impacts like fear and anxiety actually remained bothersome to them over time. So those were a bit more stable. Some positive news as well was that their positive outlook also increased over time, which we would expect to eventually have benefits on their fear and anxiety. And so what does this mean? You know, on my end, the takeaway here is that there really is a need for stress management throughout the AML continuum because of what we heard in this study, being that fear and anxiety tended to remain bothersome for quite some time. In another study, researchers surveyed patients who were newly hospitalized with AML, so a very high stress time, and what they assessed were different coping strategies. So how did patients deal with the stress of what they were going through at that point? And we typically tend to think of coping strategies as either unhelpful or helpful. What you see on the left in the picture here is avoidant coping strategies, or what we would think are of as less helpful strategies that many of us often find ourselves using, but that those who use those strategies more frequently might have more stress or more distress in response. On the right side, you see that people also used a set of more helpful coping strategies. So these are things like, for example, seeking out emotional support, trying to problem solve or seek information about things that were, sort of possible in those moments, as well as other healthy ways of coping. And what they found in this study was that people who more frequently used those healthy strategies had lower levels of anxiety and depression and had better quality of life compared to those who used those healthy strategies less frequently. And on the flip side, they found that people that use these unhelpful strategies, like, for example, blaming themselves or sort of minimizing what was going on, like it wasn't happening or wasn't as real, that those folks experienced more anxiety, more depression, and poorer quality of life. So what does this mean? To me, this indicates that even during high stress times, that the ability to cope can really matter. This can really still have an impact on how patients feel. I'd also like to share with you an exciting study that was testing out a new approach to help support coping. And this was conducted during initial hospitalization and intensive chemotherapy. And in this study, this work is still ongoing, but this was a mobile health program that was providing information, support, as well as coping skills to patients. And what they found in that study in their preliminary results was that compared to those who are in a control condition, people who used the app felt less distressed and had lower symptom burden overall. They also felt more confident in their ability to cope with AML. And so what's exciting about this work is that this shows that patients who learn coping skills, again, even during a very high stress time, can use those skills to help improve the way that they feel, and that there is likely role for technology in being helpful. And I should point out as well, I included the link to each of these studies below in case you're interested in more information. All right. So now I would like to sort of shift gears to talk about stress management tools, sort of building on the research that we just talked about. There are many well-established stress management tools that can be useful to help promote that healthy coping. Before I share a few examples with you, I also wanted to, sort of just ask if you might be open to putting an example in the chat. My guess is there are things that come to mind for you that you have used in your own life to help cope with stress. These are things that you might be doing in response to stressful situations with cancer, or these might be behaviors that you are familiar with from other stressors in your life. But I'd like to just pause for a moment and ask if you're comfortable putting an example in the chat of anything that you've done on your own to help manage your stress. So I'll pause here for a moment. So great. I see a couple of examples coming through here and appreciate you sharing. I see some examples like deep breathing and mindfulness, taking walks with a loved one. These are wonderful strategies, and a few of them we'll touch on a bit here next. And so, I think in terms of what we're here speaking about today, that what we're really hoping to do is to present some strategies that may or may not be things that you've done already. For those that are newer, to give an opportunity to sort of hear about something new and try something new. exercise, spending time outside. Yes, writing and journaling. So I am, thrilled to see these strategies in the chat here. These are all really wonderful coping strategies for helping with stress. What I'll go through with you next are sort of a whirlwind tour of a few strategies, and some of these might sound familiar based on what's been put in the chat. And I do want to point out a few things. One is that these types of strategies that I've selected to present here have been backed by decades of good research and clinical experience working with folks with cancer to suggest that they can be helpful. I would also say that they're most helpful with practice. So the first time that we use any one of these strategies, we might not always get as much benefit as we would later on after we've practiced it a bit. In addition to that, I also wanted to mention that this will be sort of a whirlwind tour. So in reality, we could probably spend an entire discussion on any one of these strategies. But what I'm hoping to do today is to kind of just introduce you to a variety of different things and hope that you'll reflect on how you might want to sort of take those away and practice something either new or refresh on something in your own time. All right, and so before we jump into that whirlwind tour, just a few general tips. When we're practicing a coping strategy, it's often helpful for us to set a realistic goal around sort of what we're hoping to accomplish. So here's a couple of examples, like reducing how much stress impacts my life or a specific thing that it's been impacting, improving sleep, reducing tension. Those are certainly realistic goals. I would say that it's, less realistic, for example, to say I want to be, completely stress-free or anxiety-free. As we talked about, these are often stressful experiences. And so sort of setting a realistic goal can keep us on track. Next, practicing can be very helpful. So as I mentioned, to get sort of the full benefit of these coping skills, it's very helpful to keep them active in our day-to-day life, especially actually during times when we're not as stressed. So if we're able to start practicing and using some of these strategies in times that are maybe a little less stressful for us, that helps us prepare so that they're easier for us to use when we are feeling more overwhelmed. In addition, I would encourage you to sort of stick with it. So using these types of skills might fluctuate over time. Sometimes will be easier or harder, depending on the day or the situation. And so if the first time you pick up and try out deep breathing, for example, it's not as useful to you, I would encourage you to stick with it for a period of time and see if maybe the next time it's a little more beneficial. And finally, for that reason, it's often helpful to have sort of a variety of tools in your toolbox to help support your well-being. Right. So the first sort of skill or strategy that I'd like to cover with you is relaxation exercises. And this did come up in the chat earlier as an example of tools that you all have used in the past. These are activities that help to calm our body physically, and then our mind can often follow that as well. And so there are many different types of relaxation exercises that a person can practice. One of those was mentioned, deep breathing, for example. This involves getting into a comfortable place, helping yourself sort of slow down for a moment and pay attention to your breathing. And so, for example, if you're sitting in a comfortable chair, you would be breathing in your nose and out your mouth and trying to slow your breathing slightly and pay attention to that. There's also sometimes that people find it helpful to put a hand on their chest and on their belly so that you can sort of feel your breath coming in and out a bit more. And it's also helpful to, for example, try to slow down a little bit by counting your breath. So for example, you might be breathing in for 3 counts, pausing, and breathing out for 3 counts. That's just one example. Another that I'd like to share with you is mindful breathing, which is not so much about changing the way that we're breathing, but more so focusing on the present moment and sort of drawing our attention to it. So I'd like to actually take you through an exercise that was a recording from the American Cancer Society that talks about focused breathing and asks you to practice that for about 5 minutes. So I'm going to try to shift gears and pull that video up. If you give me one moment, I'll try and do that. And my hope is that you can hear the sound here. And so what I'd like us to do is just to sort of each take a moment out to listen in. And if you feel comfortable practicing along, and then we'll kind of regroup in a moment here.
Cancer and its treatment can be stressful, but practicing mindfulness strategies can help. Let's talk about a specific mindfulness technique called focused breathing. Let's try it together. Find a quiet spot where you can be by yourself for a few moments. Set yourself up for success by minimizing things that might distract you. Put your phone on silent and out of reach. Sit comfortably in a chair with your feet firmly planted on the floor. Place your hands on your thighs. Your palms can be face up or face down. Sit up nice and tall. Relax your shoulders down your back. And either close your eyes or keep a soft gaze down to your lap. Notice how you feel in this moment. Take a full body scan. Start at the top of your head. Gently guide your way slowly down your face. Taking time to notice where you feel heavy or light, relaxed or tense. Not trying to change anything, passing any judgment on how you feel. Just simply painting a mental picture of how your body feels today. Now bring your awareness to your natural resting breath. And just observe it for a few cycles of inhale and exhale. Now consciously begin to make your inhalation and exhalation longer and deeper than normal. Take control of your breath rather than letting it happen on its own. Breathe through your nose. If at any point you get distracted, it's okay. Focused breathing takes practice. And acknowledge the distracting thought and gently guide your focus back to your breath. Let there be a natural pause at the top of your inhalation as well as after your exhalation. Notice the effect the pause has on how you feel. This pause will help lengthen your breath and remind you to slow down and focus on the process of your breath. This pause is the first step to meditation and quieting your mind. Start to notice how your breath moves around your body. Where does it go? Draw your attention to your rib cage and your chest. Inhales make the body expand. Exhales make the body contract. If your mind drifts away, gently guide it back to your breath. Listen to the sound that your breath makes. Feel air entering into your nose and filling up your lungs. After a few minutes, of the focused breath technique, let your breath return to normal. Stay seated with your eyes closed or soft, and compare how you feel now to when you first started. Commit to making time for these moments of mindfulness in your day, and check out our other videos for more tips.
All right. So thank you for the time to walk through that. I hope that you all, if you were able to try the exercise, did that quick check-in at the very end that she mentioned about just sort of asking yourself, how did this go? How did I feel when I got started? And how did I feel when I finished? And feel free to, put any reactions that you have in the chat about how this went for you. I did include the link below if you happen to like this exercise or want to practice it again. And I know that Katie will be providing the slides to you, so feel free to check this out again. All right, just a few more examples of relaxation exercises. As I mentioned, there's sort of a variety here. There's also progressive muscle relaxation, which involves tensing and relaxing our muscles. And that also helps us to become a bit more aware of where we might be carrying tension in our body. Guided imagery is another type of exercise, which involves imagining a sort of pleasant and calming scene, and then exploring that scene in our minds, as well as walking through our senses. So these are some examples of different relaxation exercises that you can try. And oftentimes there are online resources from health centers, as well as others like the American Cancer Society, that can help walk through these other types of exercises too. And so if you're interested in this skill, how to practice would be to select one of these exercises to try out, and then plan a time to practice. Typically we say for at least 5 minutes a day, and that incorporating this into your regular routine can be helpful in that way. It's a bit more easy to access during days that are more stressful for you. All right, so we'll move on to a different stress management skill here, which is planning and engaging in pleasant activities. This was also one that I was happy to see came up in the chat that folks have used in the past. This involves identifying and planning out pleasant activities. What do we mean by pleasant activities? Something that you enjoy doing just by doing it. So not necessarily that you just feel good after the fact. So for example, if you're completing something around the house like laundry, might feel good to get that done after the fact, but may not have really enjoyed it during that moment. So these are really thinking about things that you enjoy just by doing them, as well as meaningful activities. So things that make you feel connected to your values, to important people in your life, to your purpose and your strengths. And oftentimes we find that it's not always easy to think of these types of activities. And so it's helpful to sort of think of activities that are a bit shorter and able to be incorporated into a given week. Of course, it's wonderful to, for example, plan a vacation, or to think about taking an entire day to spend outside or go fishing. But a lot of times those might not be as feasible for a variety of reasons. And so if we want to think about how to sort of implement this in a normal week, it can be useful to think through, what are these activities for me that might take, let's say, 30 minutes or less. And so thinking about activities that are typically doable within that time, you see a list, an example here. There were also a couple of examples in the chat, like about taking a walk. I think someone mentioned yoga, martial arts, phone calls with loved ones. These are all great things on the list, and this is meant to sort of just get the gears turning a little bit for you to think through what might be some things that you personally find enjoyable. And it's not going to be everything on this list, right? And so in order to sort of implement this strategy, the idea is to incorporate some regular time week to week for these types of activities that lift our spirits and, just really engage us in life. And so one way that you could get started is by making a personal list of a few different activities that you enjoy, again, that are doable in a certain amount of time, for example. And then making a plan for how to engage in those. So, for example, in the upcoming week, what type of activity might you want to prioritize? How long will you do that? When and where and with whom, if it involves anyone else? And are there any, arrangements or sort of prep that you need to do ahead of time to arrange this activity, or things that you need to have on hand for it? After that, doing your best to stick to your plan as much as possible, or to troubleshoot, right? We know that things come up and sort of disrupt our best laid plans. Or sometimes we find, that you thought something would be really nice and enjoyable, but, you did it and you just didn't really enjoy it. And so, kind of going back to the drawing board in those cases and trying to think through how I might approach this differently next time. Another way to use this skill is if you anticipate that an upcoming period of time is going to be stressful for you. So, for example, we've been conducting some research with patients around periods of time that they are coming in for important appointments or scan results. People often say that those are high anxiety weeks. And several of those patients have told us that it's been particularly helpful for them to plan on engaging in these kinds of activities more around those times to kind of help pass the time and, again, to lift their spirits. All right. So moving along here, I'll also talk with you about another skill, which is called balancing your thinking. And this is based on the concept that our thoughts, our emotions, and our physical symptoms are all interrelated. So often when we're under stress, but also other times, we find that the pattern looks a bit like this triangle that you see here, where on the left side, if you see emotions and you notice yourself feeling stressed and anxious, oftentimes our thoughts can also become more worried or negative. So for example, what's going through my mind when I'm stressed? You see an example here. I can't handle any bad news. As well as physical symptoms. How does our body react when we're under stress, feeling tense, feeling on edge? And then how does that in turn impact our thoughts and the way that we feel? So you can see where this can sort of quickly become a vicious cycle where our thoughts become more and more negative and we become more and more stressed and on edge. And so what can be helpful during these times is sort of taking a pause when we notice, that we're feeling stressed, taking a pause to ask ourselves, what's running through my head right now? And is that something that's helpful to me? Is it something that's true? Or is there maybe a different way for me to think about this that's a little more balanced? I'll give an example here, labeling some unhelpful thoughts that folks have noticed as they feel stressed. Things like, I shouldn't be so upset, or I shouldn't be so worked up about this. Maybe I haven't gotten an important call from my doctor's office and I'm really concerned about that. Must mean something's wrong. Otherwise, they would have called. Or if my cancer's returned, no way I'll be able to handle it. These are things, of course, that are very upsetting to think about. And so when we notice ourselves sort of in these negative thinking patterns, it can be helpful to have thought through in advance a bit about more balanced ways of thinking about these things. And so that's sort of what we're talking about today, is sort of thinking about identifying some balanced thoughts that we find helpful, and then revisiting those during stressful times. So on the right, you see some examples of more balanced thoughts. And this just isn't just as simple as positive thinking, right? So we're not saying, that everything's fine or that a situation isn't stressful. but that there might be some other parts of the story too. This is scary, but I can find ways to cope with it. No matter what happens with my health, my care team, my family, my friends, they'll be there to support me, or I have other outlets that I might engage. And also acknowledging, I've been through difficult times before. I've always found a way through. And so thinking through, do any of these sort of balanced thoughts resonate with you? Certainly taking some time on your own to also think through other thoughts, other balanced thoughts that have been helpful to you in the past, or other helpful reminders that you might have said to yourself to help through stressful situations before. Not every one of these thoughts is going to sort of resonate or feel right to you. So I think it's important to acknowledge that and to, try to pick out a few that might feel a bit more like you or resonate with you in some way. And if you're interested in practicing this skill, what you could do is write down some of those balanced thoughts that do resonate with you on a note card or in a notebook somewhere that you would be able to easily see it. And practice reading those to yourself each day to keep them fresh and to sort of have them as reminders. That way, when you are noticing signs of stress, you can sort of pause and ask yourself, what's running through my head right now? Am I having any of these sort of unhelpful or overly negative thoughts? And if so, can I remind myself of a bit more balanced thinking? I will acknowledge this is a pretty difficult skill, particularly when we're feeling overwhelmed. And so it does help to have thought through these points ahead of time and to have put some practice in. And, to just sort of mention not to get discouraged if this is a tough one for you. And for that reason, we're, sort of talking about a variety of strategies, but that this is a skill that has been shown to be particularly helpful as well. All right. And then lastly, I'd like to just talk briefly about preparing for appointments. As I mentioned, we have heard from patients in several studies that I've been conducting primarily with lung cancer patients, actually, that their upcoming appointments tend to be relatively stressful, and that this isn't something that we think is, isolated to one particular type of cancer patient. This is something that we've sort of seen in the literature overall. And what folks have said is that, it's pretty common to feel anxiety before tests and appointments, but also that the time in those appointments tends to pass really frequently, very quickly, or that they might forget things that they wanted to discuss, and then unfortunately they don't get some certain questions answered. And so it can be really helpful to prepare a list of topics or questions ahead of time, partially because as we're leading up to those discussions, it can feel very uncertain or sometimes out of your control. And sometimes we have those questions sort of circling in our heads in a variety of ways, and keeping them up there can actually be more stressful to us than putting them down somewhere in paper and sort of having that be one way that we can take action during a time where there might be a lot of things that feel out of our control. In addition to that, making it a bit more likely that you'll be able to discuss those important points with your cancer team. And, we certainly know that there might be different things that need to be discussed as well, but, bringing that list along with you can help kind of remember or keep things on track so that you can bring up those, really high priority topics on your end. And so if this is something that you'd like to try out, setting aside a spot to gather those questions and store information about your care is very helpful. You can make a list of questions as they come to you, or there's a nice resource from the National Cancer Institute that actually has some different examples of questions for people at different points in their care that can also be helpful kind of food for thought if you'd like. And I'd encourage you to maybe mark the few questions that feel most important to you versus those that maybe could wait for a different appointment if they need to. Another thing that can be really helpful is bringing along a trusted person to your appointments who can help take notes, help remind you of things that you wanted to discuss, and also help as another set of ears for things that you might need to remember later on. Some additional tools that we didn't spend as much time talking about, but certainly wanted to mention to you are things like physical activity. That can be very helpful for dealing with stress. I know one person in the comment mentioned that they like to take regular walks. That is certainly something that can be helpful. Taking care of our body, eating nutritious meals, as well as enlisting social support from people. So these could be people in your life, like family, friends, neighbors, or other people in your network. They could be support groups and peers, just like you're here for a chapter meeting, other people going through a similar experience, as well as your healthcare team. And I'd encourage you to, as you're thinking about seeking social support or people who might be, good components of your social support team, I'd encourage you to think about people who can help with things like information or problem solving or getting things done, as well as people who might be, good listeners or helpful emotional supports, and realizing that those might not always be the same people, and that's okay. And lastly, many people also find that practicing their faith or spirituality can be a helpful way of dealing with stress as well. So at this point, I'd like you to just, think a little bit to yourself about one skill that you might want to revisit or try out. And let's say, in the next week, if there is a goal that you might want to set for yourself for revisiting, any of the kinds of skills that you might want to try out. Feel free to put any ideas that you might have in the chat if you'd like, or just reflect on yourself, how you might revisit any of these skills, or maybe others that we didn't touch on, but that this list reminded you of, and how you might want to go about that. Great, so I see mindfulness, that's one to revisit in the next week. As you're thinking about this, thinking through about how often might I want to practice, and when's a good time. A lot of times people do like to revisit, for example, relaxation exercises can be helpful like around bedtime and potentially help with sleep, for example. And I see a comment in the chat about that too. Great, I'm glad that people seem to be mentioning mindfulness, breathing exercises. Wonderful. All right. Well, thank you so much for engaging and for trying these out. I do want to sort of end on the note of when to speak with your cancer care team. So we've been talking a lot about these skills that we can sort of use on our own to help manage stress. And at what point might we want to seek out some additional support? So I would first like to kind of say that I would argue there's never a wrong time to ask your cancer care team about resources that might be helpful. So this is just an example question here, what resources are available to me or to my family to help manage stress as I'm going through cancer. This can be something you can ask if you feel there's a particular need at the time, or it can be helpful to ask just to kind of know what's available to you should you need it. And so I would really encourage this you to have a discussion when you have some time. There are many members of healthcare teams who specialize in helping patients cope. And for that reason, I think that's why it's important to learn sort of who those people are and what might be available to you, as well as if they're not, available on your immediate healthcare team, there might be some resources in the community that your clinic can help you identify. So these are folks like mental health professionals, palliative care specialists who are physicians and other team members trained in symptom management, and symptoms include things like anxiety, stress, depression, and generally coping with a serious diagnosis. Integrative medicine specialists who specialize in the connection between mind and body, as well as chaplains and other members of spiritual care teams. And so these are just a few that really, come to mind as specializing in helping patients cope. And, wanted you to be familiar with these folks if they exist on your team. And it can be helpful to ask. In addition, when might be a good time to speak with a healthcare professional to kind of indicate that you might need a bit more support, you're having more significant anxiety, depression symptoms, or trouble coping. So you see a few signs here of anxiety and depression, feeling down, sad, hopeless, losing interest in things that you usually like to do, as well as feeling nervous or anxious or on edge, or not being able to stop or control your worrying, particularly when these are happening for you for 2 weeks or more, and it's feeling like more days than not out of the week. This could be a very helpful thing to bring up with your healthcare provider. In addition to that, if you find yourself using unhealthy ways of coping, like using alcohol or other substances to cope with what you're going through, that would also be a good time to reach out for additional support. And I would say, especially if the way that you're feeling is getting in the way of doing things that you need to do day to day, or if you're feeling overly bothered or distressed by the way that you're feeling, these are certainly good signals to you that it would be important to speak with your healthcare provider about how you're feeling. Some signs that are more urgent that it's time to reach out to a loved one, your healthcare team, or in some cases immediately to emergency resources would be thoughts of harming yourself or others, particularly if you notice that those thoughts are increasing or that you think that you may act on those thoughts. I would encourage you to seek out immediate care. Emergency care would include things like going to an emergency room or calling 911. There are also great crisis lines available, like 988, which is a suicide and crisis lifeline, as well as a crisis text line. So I wanted to put that information in here for you as well, to be aware that there are crisis support options available for you or loved ones should you ever need them. I also listed a few other resources here that you might like to explore that really help connect or complement your care. These are places that, for example, could connect you to additional emotional support or a support group or a mental health professional. So you'll have access to these links, and there's several helplines as well that are available. There's also a nice article at the bottom from Dr. Julia Rowland, who's a cancer survivorship expert. And she discusses some considerations for choosing a therapist in the context of cancer. The article, I think, focuses a bit on post-treatment phase, but I will say I think it's relevant to folks at all points. So with that, I'll go ahead and wrap up. I just want to thank you for joining today, as well as for being so engaged with the chat and sharing a bit about your experiences. And I know we maybe got a couple of minutes here for some questions or discussion. And thank you again for having me and inviting me to your meeting this week.
Thank you so much, Dr. Derry-Vick. That was amazing. So much good info. And I really loved how you incorporated so much practical application to the information you shared, things that we can start doing today or tomorrow or whenever we're ready. So thank you for that. That was excellent. I would love to hear anybody's questions or comments that you have from from what was discussed today. I did see a question come in. Let me scroll back up. So Mary was asking, and I think this is probably from a caregiver perspective, when you were talking about balancing your thoughts and reframing. So Mary's wondering how you can help or suggest this type of mindset change to somebody who you feel might benefit from this different outlook.
It's a good question, and it's really hard, I think, to find ourselves in a position where we think that maybe someone, I'm assuming this is maybe about the part about sort of negative thoughts and more balanced thoughts, and it can be hard to hear those kinds of more negative thoughts from loved ones and realize, that there's a different way of looking at it, or that those thoughts are really making the situation harder for them. So I really empathize with this question. I think it, of course, depends a bit on the situation and the person, but if this is someone who might be venting and maybe, doesn't want to consider other ways of thinking about it, sometimes being a listening ear can be useful in and of itself. If you're hearing the same thing repeatedly and you have a good relationship with the person enough to say something like, I understand what you're saying, but do you mind if I offer a different way of thinking about it? Or are you open to my thoughts? I have a couple ideas that I wonder what you think of this way of thinking. Those are a few ways that I personally might approach and kind of broach, seeing if that person is open to some other ways that you might be thinking about the situation in a more balanced way. And that's just, an initial idea. I think the other is that if you notice that someone feels particularly stuck in a negative way of thinking, and that's really, impacting them, I would also encourage you to maybe ask if they'd be open to talking to their healthcare provider about it, or to maybe connecting with some of the resources that I listed in the later slides. Many of those resources have some helpful pages for both patients and caregivers or family members. And so they're, if you're maybe less comfortable having that conversation yourself, but you think they might benefit from thinking about things in a different way, you could help connect them to an additional resource. So those are some ideas on my end.
Great, that was excellent. Lots of thank yous in the chat. I'm not seeing any other questions come through. I had a quick one, maybe we could end on. One of the more interesting things I heard was when you were reviewing the research specific to AML and the patients who had gone through transplant. You mentioned that the physical symptoms seem to subside in a lot of people, but the mental, emotional aspects seem to linger. And I was curious your opinion on why you think that is. Is it because mental health isn't given the attention it needs and deserves during the treatment aspect, or what sort of components do you think are at play?
That's a great question. And I think, certainly I can say I think we do tend to maybe not focus as much on the psychological experience. And so that could be a component. I think with that study, one of the things that they found was that even though those physical symptoms might be there, that they just weren't as bothersome over time or as impactful. So maybe people found, ways to cope with those and had a harder time finding ways to cope with the anxiety or fear. I also think that there's been some really well documented studies to show that anxiety or sort of being on edge about things getting worse or cancer coming back, that might present itself even after some of the physical symptoms have been controlled. And so I think that, all of those things combined, and what you mentioned, Katie, about just maybe, we tend to address these kinds of psychosocial symptoms a bit less traditionally in our care. I think that could certainly play a role as well.
A testament to the power of the mind and how we should take care of our mind just as we do our bodies.
Absolutely.
Okay.
I'm certainly on board with that. Thank you again for having me. And I really appreciate all the excellent input in the chat. Clearly
Yeah.
you all have some great strategies that you're using, and look forward to having you stick with those and hopefully learn something new too.
Absolutely. Well, we're so honored for you to spend this hour with us. I'll wrap up by announcing our next chapter event. This is the last one for 2022. So we'll meet again in January on the 12th at 3:30 Eastern. And our speaker then will be Dr. Melissa Lowe. She's an AML expert from Rochester in New York, and she'll be here to talk with us about important factors to consider when making treatment decisions and how to communicate effectively with your healthcare team. The registration page for that should be up in the next 2-3 weeks or so, and you can find it at the link there on the screen. Once again, thank you to our HealthTree Community for AML event sponsors, Bristol Myers Squibb, Amgen, Genentech, AbbVie, and Jazz Pharmaceuticals. And thank you for helping us build a strong HealthTree community for AML. I appreciate you all for spending the afternoon with us. I hope you have an amazing holiday season, and we'll see you in 2023.